Hello all, welcome back to our channel. Guys, do you know health insurance claims can be confusing not because they are complicated, but because nobody explains the common questions clearly. So in this video, I am going to answer the most frequently asked questions that is related to your reimbursement claims in the MediBuddies. So let's begin. So let's see what are those queries that is related to your reimbursement claim. So here are the queries. The first query is that what are the types of hospitalization expenses that is typically covered by your policies. The next query is related to how you can raise the reimbursement claim. Then after that, what are the types of hospitalization? This is the next queries related to reimbursement claim. Then after that, what are the different types of claims that can be reimbursed? We are going to see these queries also. Then after that, the another query is related to the non-admissible expenses, like what are those expenses that is not covered by your coverage or like insurance coverage policy. So we are going to see all those non-admissible expenses in these videos. Then after that, we can see what is the deadline so that you can submit the reimbursement claim without any delay. We can see the deadline also here. Now after that, what are the documents that is required to submit the reimbursement claim. So we are going to see the those documents, what are the documents that is required for your reimbursement claim. Then after that, it is what is copay. We are going to see what is copay also. Like this is also one terms that are generally comes in this reimbursement claim also. So we are going to see this point also. Then after that, we are going to see what is the process for cashless hospitalization. So we are going to see the process for your cashless hospitalizations. Then after that, the another query is related to that, does my insurance pay for medical expenses before and after hospitalization? So we are going to see that if your medical insurance can pay your bills for your hospital stay before and after. So we are going to see that also. Then after that, the next query is related to that, how long does it take to process the reimbursement claim and when you will get your reimbursement payment after approval so of the claim. So we are going to see this point also. Then after that, is there any time limit to submit the pre-authorization request? This is the also queries that related to your time limit regarding the pre-authorization request. So we are going to see these points also. Then after that, the next query is related to that, does your insurance amount reduce after if you make any claims, like if you make one claim and it gets approved, okay, in the one financial year. So does your insurance amount will be reduced or will be like it can be deleted or not? We are going to see this point also. And after that, what happens if your cost like hospital cost bill will exceeds than your insurance cover? Okay, so if you have some insurance cover having this much of policy, like you have 2.5 lakh insurance coverage, okay, but your bill exceeds by 50,000. So what are those 50,000? So you have to pay from your pocket or not? We are going to see that also. So after that, the another point is related to the short file documents or information required, and when and where do you have to send them. So these are the documents, like suppose if you made a claim and your claim got rejected, so maybe due to some additional documents that are not available for them to verify the request. So what are those documents? So did you get any email or not? How you can send and where you need to send those documents? So we are going to see in this video. Okay, so let's go one by one with all this point. Okay, so let's begin with the first one. So what are the types of hospitalization expenses typically covered by your policies? So basically there are four types of hospitalization expenses that is typically covered by your policies. So the first hospitalization expenses is pre-hospitalization expenses. So this is the hospitalization expenses that is uh, happens before you're admitting to the hospitals. Okay, so what are those? So this includes like consultation from the doctor, like there is some test that needs to be done, like X-ray, MRI, blood test, some other test also. If some medicines are like used before you have been admitted to the hospital, so if those expenses are also included or not, so this comes under the pre-hospitalization expenses. So the next next is hospitalization expenses. So this is generally it is the expenses that is during stay at the hospital. So when you get admitted to the hospital, so what are those expenses covered here? So these are includes room rent, doctor fees, medicines and ICU charges, nursing charges. These all are the expenses that comes under this hospitalization expenses. Means it is the expenses that happens during the stay at hospital. Okay. So this is the second hospitalization expenses. Then next comes the post hospitalization expenses. So this generally includes the expenses that is after that is happens after the discharge from hospital. Suppose if your hospital, like your surgery happens successful and you got discharged from your hospital, so after that maybe some you have to visit the doctor again for your regular checkups and all. So that also requires some expenses here, so like doctor fee, consultation fee, and if there is some medication or not. See, if something happened, then retest was also required. So these all the expenses that comes under your post hospitalization expenses. Okay, so generally these are covered up to 60 to 90 days later as per your policy. If there is it is written in your policy that post hospitalization expenses can be covered also, so you can also avail that. So I'm going to explain all these things in details also, so don't worry. So okay, so this all are the test this all are the expenses that comes under the post hospitalization expenses. Then the last hospitalization expenses is the domiciliary hospitalization expenses. So this generally happens when in case of patient is not able to visit to the hospital. Okay, so this is generally home healthcare expenses. So the it includes doctor recommends home. So in this case, the doctor recommends home treatments. Okay, so and if the treatment goes beyond 3 days, and also the illness is such that it usually requires hospitalization, so this is the condition that comes for under this domiciliary hospitalization expenses. Okay, so notes, it's the condition, limits and exclusion depends on your policy documents. Okay, so if it is mentioned in your policy documents, then this can also be reimbursed. Okay, so this all are the condition that comes under this domiciliary hospitalization expenses. So I hope that all those four hospitalization expenses you understood about. Now the comes under to the next point. So how do I raise a reimbursement claim? So before that, I will tell you some other points before going to this reimbursement claim. So the next comes is the types of hospitalization. So what are those hospitalization? Let's see. So the first hospitalization is the planned hospitalization. So and the second hospitalization is the emergency hospitalization. So in planned hospitalization, if you have some ample time to plan your admission to the hospital, then it's come under the planned hospitalization. Suppose if you have some surgery, you are going to for surgery, then you need to consult your doctor ho- before get been hospitalized. Okay, so this comes under the planned hospitalization. And for emergency hospitalization, as the name already suggests, in case of emergencies, so this comes under the emergency hospitalization. Suppose if someone get accident or some emergencies has been happened, so that hospitalizations can come under this emergency hospitalization. So these are the two types of hospitalization. Okay, so coming to the next query, the next query is related to that what are the different types of claims. Okay, so basically there are two types of claim. That is, one is cashless and one is reimbursement claim. So let's go one by one. So in cashless, it is generally does not need to pay the hospital bills in front of, or like at the time of admission. You don't need to pay the hospital bills. Okay, in this insurance company directly settles the bill with the hospitals. Okay, so generally when you go for a cashless hospitalization, so insurance company directly settles the bill with the hospital. Okay, actually this is generally happens in the network hospital for which Medi Assist has some network of hospital. So this can be done from that hospital only. Okay, so insurance company directly settles the bill with the hospital. And the next is insured may have a little. Maybe you have to pay some or little money from your pocket, depending on your policy coverage. Okay, so what are the, let's see what are the conditions for cashless claims. Okay, so first point is that cashless treatment is available only at the MediAssist network hospitals. Okay, so when you go to the MediAssist portal, there is some network hospitals. You can search it by your location. Okay, if MediAssist has some network hospital, then you can go to that hospital and avail this cashless hospitalization. Okay, then pre-authorization request must be submitted and approved before or during hospitalization. So pre-authorization request means when you go to the hospital, and then you have to claim that like I want to go for this Medi Assist claim or cashless transaction, you have a policy, insurance policy. So you can avail that by going to their Medi Assist portal, and then have some authorization request. So it should be submitted before or during your hospitalization. Okay, so it should be submitted. So next comes is the cashless facilities is applicable only after approval from MediAssist. Okay, so cashless facility is all applicable only after approval from MediAssist. Means suppose if you if you have raised a request for the cashless claims, okay, and you have already gone to their network hospitals, but suppose if something happens and your cashless hospitalization claims can be rejected. Okay, so in that case you are not able to avail these cashless facilities. Okay, now the next type of claim is reimbursement claim. Okay, so in this claim it is generally you have to pay the hospitalization bills from your pocket first. Okay, you don't get any insurance claims or any reimbursement at the time of your hospitalization. Like suppose if you go into the hospital and in cashless hospitalization also, suppose if you are at the network hospital and your cashless bills got rejected, so in that case you have to pay the bills from your pocket. Okay, so here what in reimbursement claim what you can do, first you have to pay the bill from your pocket, then you can raise a reimbursement request, okay, to get the money as per the policy terms. Okay, from in the Media Assist portal you can raise a request for the reimbursement claims. So let's see what are those conditions for this reimbursement claims. So in these following cases you can file the reimbursement claim, first point is like hospitalization at the non-network hospitals. Okay, so this point is suppose if you didn't find any network hospital bill that is registered on the Media Buddy portal or Media Assist portal, so in that case you can go to any of the network hospital. Okay, like from your location, whatever is easy for you to go that, so you can go to their non-network hospital and you can pay the bills first. Now you can raise a reimbursement request from your MediBuddy portal. Okay, so pre-hospitalization and post-hospitalization expenses such as test and medicines. So suppose I've already told about this pre-hospitalization and post-hospitalization expenses. Pre-hospitalization expenses is if something test or medication or consultation is happening before your hospitalized before you has been hospitalized, so that comes under pre-hospitalization. So in that case also you can also raise a request for that reimbursement claims. Okay, so and for post-hospitalization if your surgery has been done or something has been done and you are discharged from your hospital, then that whatever the expenses that happens after your discharge from the hospital, that comes under this post hospitalization expenses. So in that case pre and post hospitalization expenses reimbursement can also be claims. Okay, so through their reimbursement types of claims. Okay, so now the denial of pre-authorization for cashless treatment at a network hospital. So see here, I already told you that earlier in that cashless hospitalization, suppose if your hospitalization bills are mm, it's get rejected from the cashless hospitalization. So in that case, you have to pay the bill first, and now you can raise a reimbursement claim through this process, reimbursement claim process. Okay, so this is the reimbursement claim types. Now coming to the next query is related to the what is the deadline to submit a reimbursement claim. So generally claim intimation must be submitted within 7 days from the date of hospitalization or injury. Okay, so if you want claim or reimbursement, so you have to submit you have to intimate them the Media Assist portal or Media Assist team before or within the 7 days. Okay, from your date of hospitalization or injury. Okay, so make sure that you made a intimation request for your reimbursement claim within 7 days. Now, claim intimation means informing MediAssist that reimbursement claim will be raised. Okay, this is generally someone, suppose if you're not able to uh, like uh, tell them that my claim, I have to raise a reimbursement claim for my medical bills. Okay, so this generally takes some there are already 7 days. Okay, you can tell someone that okay, I want a claim. You can tell them that this particular person need a claim for reimbursement or whatever, so it should be submitted within 7 days. You have to just generally inform the media system that a reimbursement claim can be raised. Okay, So this is generally. Uh, Now, what are the details required at the time of claim intimation? So let's see what are those details. So see here, policy number. Suppose if your company have already given your insurance, so you have already a policy number. You can check it in your MediAssist portal by going to their account or accessing your account and e-card of that MediBuddy portal. Okay, from there you can check it. Now, name of the insured person for whom the claim is made, like the claim for whom, like for whom you are making a claim, their name should be mentioned. Okay, in the claim it should be the patient name only. Okay, now nature of illness or injury, like what kind of nature or what kind of illness or injury that person is having, so you have to tell them the name and address of the treating doctor where you are taking a consultation or medication. You have to tell all these details, and the name and address of the hospital or nursing home, so you have to tell all these details to the at the time of claim intimation. So okay, so these all are the details here. Now coming to the what are the documents must I submit for reimbursement claim. So here you have to submit all these documents to raise a reimbursement claim. Okay, so let's see, these are original hospital final bill, the original numbered receipts for payments made to the hospital, then complete breakup of the hospital bill, original discharge summary, all original investigation reports along with the prescription, all original medicine bills with relevant prescription, original signed claim form, and then copy of Medi Assist ID card or current policy copy and previous year policy copies, if any, covering a letter starting your complete address, contact numbers, and email address. So these all are the documents that you need to submit to the Medi Assist team for your reimbursement claim. Okay, you can go through this part. Okay, so copy of Medi Assist ID. This is generally the e-card. You can also submit there. Okay, by accessing through your if you are individual like you have registered for the Medi Assist claim, then you can you have already ID Medi Assist ID. If you are a corporate employee, then you can check it from your e-card also. Like you can download the e-card from the Medi Assist portal. Okay, so these all are the documents generally are required for the reimbursement claims. Now, what is copay? So see, this terms generally comes in this medical claim. So let's see what is copay. So it is the percent applied on payable amount which the policyholder has to pay at the time of discharge. So what is copay is like? It is the percentage applied on payable amount which the policyholder has to pay at the time of discharge. So suppose some policies like your policy coverage has maybe like at the time of discharge he will pay only 75%, then you have to pay the bill like 25% from your pocket, you have to pay the bill. So this is generally called copay. Okay, so rest of the amount is paid by the insurance company. Okay, so I already told that if company has some terms and condition like they have only pay 75% from them, then 25% you need to pay from your end. Okay, so this is the OPEP terms. Okay. Now, what are the non-admissible expenses? So non-admissible expenses is like the company or the insurance company cannot claim or make a reimbursement. Like they didn't give you reimbursement for this non-admissible expenses. So what are those non-admissible expenses? Let me show you the PDF first. Okay, so I have opened the PDF here. This is the PDF for your non-admissible expenses. Okay, so let's see. Almost 199, I guess. See, almost 199 expenses has been written in this PDF that are not going to be payable. In some cases, like some of the expenses that are payable, but that comes under some categories. So they already mentioned that this comes under this part, so that can be payable, or whatever are not payable, so they already mentioned that these particular expenses are comes under this not payable, like they will not going to pay any charges for your this reimbursement claim. Okay, suppose if you are you so the bill of this I sealed, then they will not take this as a reimbursement claim, and they will told you that okay, this particular things is not payable, as I already mentioned in the PDF. So these all are the terms and condition for this MediBuddy. Okay, they have already mentioned this particular cases, what can be payable or what cannot be payable. Okay, so you can go through this PDF. I will share you the PDF link with in the description box. You can check the PDF links. Okay, so these all are the things that comes under the non-admissible expenses. So I hope you have seen the PDF. Okay, I've already shared the link in the description box. You can check it now. So guys, this video is already so long, so I am just stopping this video here. I will tell you the further queries related to that reimbursement claim in the next videos. Okay. Till thank you all. We will meet you in the next video. Bye bye.